The aftermath of Hurricane Beryl sent a wave of patients to Houston area emergency rooms, causing a strain on hospitals and medical resources. Joining us live to talk more about this issue is Dr. Owais Durrani, emergency room physician and the host of STEM City right here on KPRC2. Well, it's been, 12 days now since Hurricane Beryl made its landfall here in Houston. Talk to us about the current state of the hospitals in our area, where we're at right now.
Yeah, it feels like a blur. It feels like way shorter than that and way longer than that. The hospitals are still really, really busy. You know, an example is, for example, I worked the last 2 days, and so 2 days ago I left during the evening shift, went home, came back in the morning. Some of the patients I'd admitted to the hospital, they were still in the ER, and that's because there's just no room for inpatient beds. Everything's still backed up, and so even those patients that came last week, you know, they were obviously maybe didn't have oxygen. Even though when you put them back on oxygen, they may have heart issues, kidney issues, those become decompensated. And so to fix them and get them back to a point where they're stable for discharge, that can take days. And so those patients are still, you know, in those inpatient beds, and hospitals are backed up, and transferring patients is an issue. That's a big part of our job. You know, if you got your surgery at X hospital and they show up to my hospital, it's best to get them to the hospital they got the surgery at, but that's not possible because that hospital is full, so they can't accept them. So everything's still, it's better than last week for sure, but it's still gridlocked.
Yeah. What is the need you are seeing during this time, or you were seeing a week ago?
Yeah. So there was different phases to it. Initially, when people lost their power, and thankfully most people have it back now, but initially, you know, if you're dependent on oxygen, if you have like COPD, asthma, you might need oxygen 24/7. Your respirator needs power. When that's gone, you have to go to the ER to get oxygen. And initially, they didn't have those centers where we could discharge those patients to, so they were stuck in the ER, even though, you know, for the most part, they were stable once we put them on oxygen. Second big group of patients I saw were patients needing dialysis. So you need 3 days a week dialysis. If you're in kidney failure, you miss one of those, and even that can be life-threatening. And so those dialysis centers didn't have power, they were closed, and so they had to come to the ERs for dialysis. And then finally, if you run out of your high blood pressure medication, your diabetes medications, those conditions become decompensated. You're gonna have to go to the ER. A lot of times those patients are very, very sick, end up in the ICU. So just a broad array of things, and then add heat onto that. It was very hot. Young people, and then elderly, of course, were you know, dealing with severe dehydration, even heat stroke, and so we were seeing that as well.
That's really tough. You know, these issues, as you mentioned, they're cyclical, but then when you factor in the patients, these patients are vulnerable as it is, and when you factor in, when you combine these elements in the current environment, that makes it really tough. Talk to us about, you know, we're always doing stories on the blood supply shortage. What did this do to the blood supply?
Yeah, it strained it even more. I've seen, you know, the reports, and since the pandemic, our blood supply really hasn't been up to par. During the summer season, the use of blood becomes more because of traumatic injuries. And then, you know, colleges are out, there's remote work now, and so those donation drives aren't the same as they were maybe 5 years ago. And so during the summer months, it's a low blood supply as it is, it's post-pandemic, and then this happens. So, of course, you have a lot of sick patients, a lot of them need blood, and there's nowhere to donate blood. Those centers are out of power as well. And so there was numerous times where thankfully the hospital I work at didn't run out of blood, but if I have 2 patients, they both need, say, 2 units of blood, the blood bank would say, hey, we're just gonna release a unit at a time, because you never know if a trauma comes in the door and they may need a lot more blood than these other patients. So that's something that's not common rationing in the, you know, healthcare system here, but there was some of that, especially around blood.
With that said, is there a way for hospitals to prepare for events like this?
Yeah, so I think that it requires a lot, right? So it requires stocking up on supplies. For example, staff members, doctors, nurses, techs, came in the night before the hurricane, and so getting the staffing bolstered up, so when that does happen, and you're not stuck without, you know, staff in the morning. And then coordinating better, in my experience with city services. You know, I'm not an admin or anything like that, but it feels like, you know, that first day or so, we didn't have, you know, safe places to discharge patients to. When they did open up, they filled up really, really quick. And so then day 3 and 4, you're like, hey, can I discharge this person who needs, you know, some power for their oxygen concentrator and a cool place? And they're like, nope, that's full. They're stuck in the hospital. And so having those things that are more streamlined, and we're not, you know, trying to figure it out last minute.
Yeah, there are a lot of layers to this, and it stretches beyond just the nuclear hospital. It stretches out into the community as well.
Exactly.
That preparation. Okay, really good insight. Thank you, as always, Dr. Durrani. We appreciate it.